Behind every public health initiative is someone who chose to dedicate their life to community wellness. Today, my guest shares her story and the lessons that could change how you think about working in this field. You're listening to the PHEC podcast, episode 422. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guests and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. Today, my guest opens up about her professional journey, from her early passion for behavioral health to leading overdose prevention efforts, and shares insights about networking, mentorship, and navigating challenges that come with working in this field. If you're new to this podcast, let me take a moment and introduce myself. I'm so glad that you're here. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, helping our clients communicate their health information in plain language to the community partners, as well as the broader communities they serve. The support we provide often falls in the category of strategic planning and sometimes capacity building. It just depends on the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links are also going to be provided in the show notes. I'm excited to introduce all of you to my guest on this episode. Let me formally introduce her to you, and then I'll connect our conversation. Parnia Roghani-Shareef is a public health professional with a passion in behavioral health and leadership and workforce development. She is currently the Assistant Director of Programming for the Region 4 Public Health Training Center at Emory University, where she oversees strategic planning development and implementation of programs in the 8 southeastern states. Committed to strengthening the public health workforce, Parnia has coordinated and developed training programs and leadership initiatives aimed at enhancing the capacity and effectiveness of public health professionals. She also has extensive experience in cross-sector collaboration to reduce opioid overdoses through data-driven strategies and awareness campaigns like Deactivate Opioids for a Safer Community, and has contributed to launching the Overdose Fatality Review Board in Pasco County, Florida. Actively engaged in public health leadership, she serves as president of Florida Public Health Association, co-chair of the Opioid Action Awareness Committee for the Alliance of Substance Addiction Prevention, or ASAP for short, and a member of the Pasco County Opioid Task Force. Parnia's contributions have earned her several awards, including the Florida Public Health Association's Meritorious Service Award 2023, ASAP's Volunteer of the Year Award 2023, and Outstanding Staff Team Award from the University of South Florida in 2024. Prior to her current role, Parnia was the Program Planner Analyst at the Center for Leadership in Public Health Practice, College of Public Health, University of South Florida, where she oversaw training programs and workforce development needs for the public health workforce in Florida. Let's connect my conversation with Parnia right after we highlight our sponsor for this episode. The Public Health Epidemiology Conversations podcast doesn't stop when the episode ends. Now the conversation continues inside the PHEC podcast community app. It's a private space designed just for public health professionals, where you'll find exclusive episode content, member-only discussions, live events, and even chats with podcast guests. No negative noise, no social media distractions, just meaningful connections and support to help you grow. Download the PHEC podcast community app today and join us. Hi, Parnia. Welcome to the podcast. How are you?
Hi, thank you so much for having me. I'm good. How are you?
I'm good. I'm good. I'm excited for our conversation today. It's been really nice to get to know you over the last couple of months, and thank you for the opportunity to speak at Florida Public Health Association. That was phenomenal. So at the time that you and I are recording, because I tend to batch some of my interviews on the same day, I just had a conversation with Marissa, Dr. Levin, who was also, she and I shared the stage there, and we were recapping. So I don't know if her episode will come out before this episode with you, but make sure that you're checking out, because we did refer back to our time there quite a bit. So it's good to see you again, and thank you for that opportunity.
Good to see you.
Well, why don't you tell everyone a little bit about yourself?
First, thank you again so much for having me. I'm really excited and honored to be here. So, I've been in public health for about 10 years. My journey started as a dental receptionist at a community health center. That's where I started to see public health in action. We were really focusing on increasing access to services to the underserved community. And so I did that for a little bit. And from there, I went on to become a case manager for a Housing First program where my clients were previously unhoused with severe mental health issues. And that's where my love in behavioral health began. I was always passionate about mental health, but this is where I saw the system fail so many people. And so I wanted to improve the system. I wanted to increase access to services, and I wanted to make sure that everyone received the care that they needed and that they deserved. And during this time, I was going on to get my master's in public health at the University of South Florida. So I decided I wanted to focus on behavioral health, and I wanted that to be my main career focus. And during that time, I started a new role at a local hospital doing a lot of community work. It was a lot of prevention, working with youth, going to schools, teaching life skills. And that led me to the Alliance for Substance Addiction Prevention. It's a prevention coalition in Pasco County, which is north of the Tampa Bay area. And so that introduced me to overdose prevention, and I was able to run campaigns, host town halls, partner with community partners and members. And I even did my internship with them, which was really cool. It was a focus on stigma and mental health and changing our language, shifting the way that we think and talk about mental health and substance use. And so I finished my master's, and from there I started a position at the Florida Department of Health doing the overdose data to action for fellowship. And I did a couple other roles in between, but more recently, my focus has shifted to leadership and workforce development. I had a challenging experience at a previous role, so I wanted to support the public health workforce. I learned how important leadership was, especially in public health. So I wanted to be able to support the current and even the next generation of public health professionals. And that's where I started working with Dr. Marissa Levine at the Center for Leadership and Public Health Practice at the University of South Florida. And yeah, right. And I just started my new role back in February doing a more broader workforce development, which we'll talk about that in a little bit as well. That's my story.
That's really awesome. I always love to hear people's journey, because you never know. Just, some people say, I knew I wanted to do public health early on, and they set the path. But a lot of people it's a path of discovery. You experience this, you learn about this, and then you do the next thing. So that's a really interesting journey. Is there a particular population or condition or problem or challenge that you're most passionate about right now?
I think the question is, what am I not passionate about? I love public health in its entirety. I love everything about it. I think my biggest passions are, like I said, are behavioral health, mental health, and overdose prevention, really working to break down the stigma and increasing community support and services to those in need. And also workforce and leadership development. I think public health is so burnt out, and we have been through a lot the past few years, and I don't know if there's an end in sight right now. So I love having the opportunity to help support our public health professionals with tools and confidence they need to help them continue moving the needle on the complex challenges we face in public health.
Yeah. Yeah. I'm just chuckling, because that is very common for us to have. We're all so multi-passionate in this field. There's not just one thing or one area, right? But because of the nature of public health and how there's so much overlap, we do get to have impact in so many different places as well.
Exactly.
Well, let's talk a little bit more about your current role. What do you do now? And tell me a little bit more about your current role, which I know you wear many hats. So just start to dive in there.
Yeah, so like you said, I do wear a couple different hats. So I'll start off with my day job and then I'll go into the other roles that I have. But my day job, I'm Assistant Director of Programming at the Region 4 Public Health Training Center based out of Emory University. We are one of 10 Human Resource Service Administration funded training centers. So it is a national program, but Region 4 focuses specifically on the 8 states in the Southeast region. And so we help public health professionals build the competencies necessary to address current and future public health challenges through professional development. So we offer webinars, which you're actually going to be doing one for us soon, workshops, podcasts. We have self-paced modules, echo courses, and we also do have a leadership institute as well. We work with students, so we offer experiential learning for the future workforce through student field placement programs, and we provide consulting and technical assistance for health departments throughout the Southeast region as well. Another part of my job is I am on the learning agenda for systems change work group, and we have created a toolkit which focuses on tackling complex and adaptive challenges by building shared understanding and how we can do collaborative problem solving across organizations and communities. So that is a partnership between the 10 training centers and the Policy, Practice, and Prevention Center at the University of Illinois Chicago School of Public Health. Our second version of the toolkit is going to be available soon. It is available. We do have a version available on our website. So for those that are interested in checking it out, I highly recommend if you want to learn more. And so the next hat that I wear, I'm recently president of the Florida Public Health Association, and through FPHA, we really strive to strengthen and be the voice of public health in Florida. We have a couple different committees. We have a policy committee, we have a student engagement committee, we have a mentorship program, and we're also working on relaunching our membership committee. We also have the annual education conference, which Dr. Huntley, like you said, you were there, and thank you again for being a keynote with Dr. Levine. And we offer learning and networking opportunities for our members throughout the year. So it's a great way to connect with other public health professionals throughout the state. And the last hat that I wear is I still work very closely with the Overdose Prevention Coalition. So I co-chair their Opioid Action Awareness Committee. And this committee is where a group of community partners come together and we work to address addiction and overdoses. We have launched various community programs and campaigns. We're planning our 5th town hall that's going to happen later this fall. We've held PSAs to raise awareness and education. And our most recent project, which I'm really excited about, is we are finalizing the final steps to put out harm reduction vending machines out throughout the community. So I'm really excited about that.
Wow, tell me a little bit more about that. What would be in the vending machines?
Yeah, so we are going to have Narcan, doTERRA bags, which are medication deactivation bags. So if you're looking to get rid of a medicine, you just stick your medicine in there, pour some water. There's some charcoal in there that'll deactivate the medicine, and you just toss it out in the trash. Safe and effective for the environment. We are going to put fentanyl test strips, HIV test kits, and hygiene kits.
It's fascinating that you have such a variety of, and I know people in public health, we tend to get, like I said, we're involved, we have multiple passions and we're involved in different things in different areas, but you do seem to have a really nice balance of opportunities and leadership roles and positions. Is there, I'm not sure which one you want to apply this to, this next question, but are there some specific challenges that are rising to the top for you right now? I feel like there's so much happening in public health, especially right now with this being the end of summer of 2025 as we're recording this. But are you seeing some specific challenges that are especially challenging or that you're trying to deal with right now?
Yeah, sadly, there's a lot of challenges, and sadly, they apply to everything that I'm involved in. I think the biggest one is, like I said, public health is burnt out. Between the burnout, between the uncertainty, the unknowns, we don't know what's going to happen. A lot of people don't know what's going to happen to their funding, their jobs. So there's just a lot of uncertainty. And I think with that, unfortunately, we talk about how important public health is, how important prevention is, we're put on the back burner a lot. I mean, if we look at the opioid crisis, for example, had we had preventative measures put into place beforehand, I don't think we would be where we are now. And so investing into prevention, it might be more costly upfront, but it saves us so much, not just financially, but it just saves us so much in the back end. I think it would be an opportunity to create healthy communities where everyone is thriving and everyone has the measures and opportunities in place to help them grow and succeed. And I think another thing is during COVID, people lost trust in public health. People saw science play out right in front of them, and they couldn't understand why the guidance kept changing. They couldn't understand why we said, wear a mask. Wait, don't wear a mask. Do this, don't do that. And I think the general population couldn't grasp all these different, it almost felt like public health didn't know what they were doing. And I think we're still working to build back that trust, but it's proven to be a lot harder than we probably ever imagined.
Yeah, I definitely understand that. And I think a lot of the shifts we're experiencing politically are not helping us with this effort to rebuild trust. But what are some of the things that you're doing to kind of address some of these challenges?
Between the Public Health Training Center, we're continuing to offer trainings. We're continuing to offer resources to our public health professionals to help build that workforce. Through FPHA, we're offering networking opportunities. We do have a mentorship program that will be kicking off, I think, our 4th cohort soon. So another opportunity to really just connect and talk through a lot of the challenges. I think I always love FPHA's conference because it's so many like-minded people coming together, and sadly we can relate to everything going on, but I think it's also really helpful to be able to talk through some of that with someone who understands.
Yeah, I think you are doing a great job with that too, having firsthand experience there. I think that the mentorship is important. I know I found myself also pulling people in close because these are folks that are choosing to still do the work of public health, even when it seems like we're going against the grain and against the wave. And so I really appreciate the way that there's a supportive theme, or you could feel it across the room. That's really nice. And I also am looking forward to the webinar. That's a great resource. And actually, living in the southeastern region is especially nice. And this is the first time I became aware of some of those resources. So those are some great ways to kind of address some of these challenges. And I think a lot of it is just what I'm seeing across the last few months. I did a lot more speaking and traveling across the summer than I normally do in the summer, but it has been really interesting to see the consistent efforts. When I get in different rooms, there's always this feeling of people being able to exhale and relax a moment, and people, understanding each other and in a way being able to recharge. I've facilitated a lot of workshops, more, like I said, more than I usually do, but it feels like people are just hungry for it right now. So it's great to be a part of that, addressing that challenge. And then, everything that you're speaking to is consistent with what I'm seeing and hearing as well. So it's how we're kind of looking out for each other and then trying to decide, what the next steps are and taking action together. So really glad to hear some of that as well. So let's do a little bit of connecting the dots. And that's just essentially, I know our audience for this podcast is pretty diverse. So we've got a lot of public health professionals. We've got other folks who are curious about public health, and then people that are kind of interdisciplinary. They are maybe traditionally trained healthcare and then are now in public health, which is very much my background of healthcare and public health. But sometimes even in public health, we can be a bit siloed and kind of know our niche in our area. So when I talk about connecting the dots, it's really connecting public health, epidemiology, and other industries. So my next question, and I think it's just there's no right or wrong answer. It's really just your words and how you can talk about this. And I think this helps people all that I just described. So then the next question is, how do you explain the importance of the work that you do and its connection to public health and or epidemiology specifically, but in conversations with your family, friends, community?
I think it goes back to public health is everything. It's everywhere. It's making sure the air that we breathe and the water that we drink are safe. It's preventing disease before it happens, whether it's through vaccinations, policy changes, health education. a lot of our work is on the back end, and so people might not see it, but it touches them in every way of life. And so public health it's more than telling people what to do. And I think people have a hard time understanding what public health is because it is so broad. So, with family and friends, it really takes a lot of communicating and educating them that we are all public health in so many different ways. And we can all play an important role in making sure our communities are safe and healthy. And at the end of the day, whether you're in public health or not, we all want the best for ourselves and each other and our communities. So why not work together and make something beautiful instead of, like you said, working in the silos?
I like that. This is really connected to the topic that I'll be covering in the webinar that I'll be hosting for you, but for Region 4. But it was easier to just not even try to explain it to family and friends because it's so complicated. I thought, it's just like so much work. I can relate when people feel like, I'll just give a watered down version. But I think now more than ever, we understand how important it is to make sure that we are proactively, communicating with our family and friends. And over the last several years, I really, with a lot of intentionality, look for those opportunities to explain it. And not that I'm trying to lecture anyone, but just bring it in the conversation, those moments. And sometimes I chuckle to myself when it lands well, and then other times when it's just a flop, to just make it easier for me I can laugh at it, but I have to keep trying to explain it. I'll give you a great example. Our neighbors across the street, they've been in their house. They moved in a few years after I did. We basically raised our kids. They've all grown up together. So we watched all these kids grow up. And one of their kids just graduated high school, and she's like the top of her class, and was going off to college. So I saw her. She came over and started chatting with me, and she's like, I'm leaving for college. I was like, well, what are your plans? I always ask that question. And she explained that she's majoring in like biochem or something like that. And I was like, of course I got my attention. So I'm listening and listening. And she's like, I don't know if I want to go to medical school. And I'm just still listening. And she just continued to explain to me that the high school where my kids all went, where they went, they built a public health. It became one of their centers. So the kids they can go into healthcare and do like nursing, or if they're focused on different core health programs, they can get this training in high school. But they added a public health element. This was, I would say about maybe 8 or 10 years ago, they added that element. So I thought it was really interesting that she mentioned that because she was interested in medicine potentially, she took some courses in this center and learned about public health. So she was able to say, like, right at, while she's considering this healthcare career, she also is aware of public health options. And she's like, well, I'm not exactly sure what direction I want to go in. I'm going to start exploring some things. But I just thought inside I cheered. I thought that's such a win, because here she is now. She understands at least that that's an option, as opposed to a lot of folks who don't get that introduction early on, and they're stuck with trying to figure it out a little bit later. So I thought that's a win for public health, in my opinion. Like, if they're coming at that point and they can understand what public health is, and they're in fact filtering it in, it was great. It was great to have the conversation. I was like, well, that's, where I work. And she's aware. She knows I'm a resource. So I think that to me was a great example of how you communicate that on a very neighborly friendship kind of level. And you just never know.
I think it's one of those things, I always say, breaking down stigma, the more you talk about mental health, the more it breaks down the stigma. But I think it's the same for public health. The more we talk about public health, the more we educate others. Public health is this, and this, the more it's at the forefront of people's minds.
Yes. And that's exactly that's where we need to be. So for all the areas where we are lacking, we have these challenges, it's nice to be reminded that we are doing some things right. So this introduction to public health in our public school system is great.
Amazing.
Yeah. So your response reminded me of that story. All right. So let's talk a little bit about, you mentioned earlier, I kind of described the audience. I described our audience as diverse. We do have a lot of students that listen, and you talk about the importance of mentorship as well. So do you have any advice for someone who may be a student, professional, who is listening and also maybe interested in some work similar to what you're doing?
Yeah, I think the biggest piece of advice I have is network, get involved, volunteer. We're in public health because we care. So if we get involved, it's not for the sake of getting involved. We can actively be a part of the solution. And I credit a lot of my experiences that I've had, the campaigns that I've been able to build, my experiences through FPHA. I've been able to do Hill Days and, things like get that. It's really given me so many different experiences and opportunities to make me feel like I'm making a change for the community that I serve. If you're in Florida and if you're not a member of FPHA, join now. Or if you're in another state, join your state affiliates. That's another great way to connect with so many other professionals. APHA, if you want a more national focus, and just look for other organizations and coalitions of interest. I truly don't think I would be where I am had I not gotten involved and networked the way that I did. Another thing I want to say, and I wanted to mention it earlier, I'm sure you and Dr. Levine talked about it, is self-care. Make sure you're taking care of yourself because you can't fill from an empty cup. And I know Dr. Levine always says an important part of leadership is just taking care of yourself. So that's the biggest piece of advice that I have is it's easy to get wrapped up in the news and all the negatives, but we have to take care of ourselves to continue to show up for our communities.
Yeah, I absolutely agree with you. And we need to make sure that we're reviewing what that looks like. I mentioned this when I was in Florida because what worked for you 6 months ago or last year may not be working well now. So making sure that we are prioritizing ourselves is really important. I love that. I love all of that. I think that as you mentioned, being a part of your state affiliate, I would just add that even your neighboring state affiliate, here in the Southeastern region, I love participating in networking with everyone in Florida. I'm in South Carolina and you're just a couple of states away. And I have so many colleagues in Georgia and Mississippi. And so this region, there's so much overlap. And I think that it's important to definitely connect right in your state, but also your neighboring states. I think that there's just, in this day and time, I'm really just thinking about and feeling the impact of collaboration. So being able we're stronger together. So don't be afraid to connect with your neighboring states as well.
Yeah, and this year at FPHA was really cool. We had a lot of folks from Georgia come. So yeah, absolutely.
I really like that because they didn't have their conference. So a lot of them came over and a few of the speakers actually mentioned that directly, how much they appreciated to reach out to their neighbor. And that's a good feeling. And that's part of our strength.
Yeah.
So, I have questions here. So we could probably talk on and on. To be mindful of time, I think I'll narrow it down to just one more question. I think we'll do. And this is an easy one, and we're going to provide links and everything in our show notes. But what is the best way for our listeners to connect with you?
Yeah, so I'm most active about my public health journey and experiences on LinkedIn. It is under my name, Parnia Roghani-Shareef. So that's probably the best and easiest way to contact me and connect.
Wonderful. And I love that too. And I would highly recommend doing that. Thank you so much for taking time and coming on the podcast and chatting with me. This feels good to have these kinds of conversations. I love podcasting, obviously. I've been doing it for a very long time. I love the conversations. I love the relationships and connecting with people in person and then like this virtually and continuing to highlight the work that folks are doing and how we are definitely talking about the challenges that we're facing, but also how we're winning and how we are succeeding and things that we're doing well. That's important. You gave a lot of great bits of advice and reminders all tucked in here. So this episode will roll out before the webinar that I'll be doing for Region 4. However, what I will do is after that is complete and we have links to it, I can share those on the show notes page. So in the future, when someone's listening to this episode, then they'll be able to come back and connect with that as well.
That sounds great.
So thank you so much for being here. This has been fantastic.
Thank you for having me. I'm absolutely honored to be here with you.
Awesome. And we have to keep in touch for sure.
Yes, definitely.
I really hope you enjoyed that conversation as much as we did. I look forward to keeping in touch with Parnia and having her back on the podcast again in the future for updates. I encourage you to connect with her and learn more about the work that she's doing. When you reach out, be sure to let her know that you heard her episode on this podcast. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 422, can be found at phecpodcast.com. Once you're there, just navigate to episode 422 to find the show notes. One more thing before we go. Remember that our podcast now has a new app where we can continue the conversations from episodes like this one with public health professionals around the world. You can download our new PHEC podcast community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.